Okay, we are now recording. So welcome everyone to our talk today. We are Genetic ALS and FTD and the Legacy. My name is Jean Swidler. I am the chair of the group. I am a C9orf72 expansion carrier, asymptomatic, and I have lost many family members to ALS, as I know many of you have to ALS and FTD. We are, of course, always interested and fascinated with any new insights into what might be linked to these diseases presenting and getting worse. I was so happy to spy on Twitter a congratulatory post to our guest today, Anna, about her poster at a conference. And I do this all the time. These people are more showing that they're presenting at a conference, not really that they're showing what they presented, just more like, hey, I'm doing a good thing today. And I just like zoomed in and saw like, oh, cardiovascular health and genetic FTD. That's now, we can all control our cardiovascular health on some level. So this is really interesting. So Anna has been very gracious to give us this time. So with that, I will give it over to you, Anna.
Awesome. Thank you so much. Let me just make sure I get all my stuff situated over here. Hi, everyone. It is so good to be here today. Thank you so much for joining online. I'm super thankful to be here, and thank you, Jean, for inviting me and for spying on my Twitter. I appreciate it. Like Jean said, my name is Anna VandeBunte, and somehow I'm already approaching my 4th year in my PhD right now. I'm fortunate enough to be able to say that I'm working at the UCSF Memory and Aging Center with my PI, Dr. Caitlin Castelletto. Some of you might be familiar with her, and I will be talking a little bit about some of her work today as well. Before I jump into the content of the talk today, I wanted to give you a quick background on how I ended up here, somehow giving you this particular talk today. I've always had a really natural interest in lifestyle and in exercise particularly. I actually played volleyball in college, and when I stopped playing, I had a ton of free time on my hands, so I was trying to find a new passion and was lucky enough to end up with an academic advisor who was a neuropsychologist. And this kind of marked my journey with the brain back in 2015. And what I noticed when I was working in neurology clinics was that every time I was testing a patient that had exercised or that had engaged in a healthy lifestyle, I really noticed a difference in their cognitive and functional trajectories over time in their brain health. And this really inspired the questions that I have now, which ultimately led me to Dr. Castelletto, who works with physical activity over at the MAC, at the UCSF MAC. MAC is the Memory and Aging Center, for those of you who don't know. And over the last few years, I've really developed an interest and a passion for cardiovascular health in particular, and the role that it plays in healthy brain aging, which is why I'm going to talk to you about that today. But it's just truly been such a joy to have my passions and interests kind of fusing together. And this project I'm going to talk about today has particularly been really exciting for me because it's an opportunity to be able to look at genetics and lifestyle really directly. So let's jump in with a quick refresher on modifiable risk. We'll make sure, let's see. Awesome. Okay. So one of my favorite things to tell patients, or really anyone who's interested in leveraging their lifestyle to keep your brain healthy, is that 2 out of 3 cases of dementia are attributable to modifiable risk, or one of these factors listed here on the screen. So what does that mean? That means essentially that 3 people with dementia, or out of every 3 people with dementia, 2 of those people have dementia to a modifiable risk factor, meaning the cause or the etiology is based on one of these factors seen here, above and beyond genetics. So we know it's really important to focus on modifiable risk in general, but obviously particularly when you already have a high genetic risk. So the last one here on the screen is my particular favorite and what I'm going to be talking about the most today. I find it the most important because I see it as the thread that kind of underlies why some of these other factors are even making it onto this list. And this list is from Barnes and Yaffe, like it says there, but Lancet has come out with a more recent list that includes all of these as well. So what is vascular? We know that vascular, broadly speaking, means the health of the blood vessels. We know the blood vessels are incredibly important for our general functioning. They not only transport nutrients to the organs and tissues within the body, but they also transport waste out of those organs and tissues. And they obviously also provide oxygen to our entire body through the blood. So the vasculature is incredibly important. Most of us know this term cardiovascular health. It's a little bit more commonly known and understood. We've all heard of the importance of heart health, exercising for your heart, and we've even seen on food labels to be focusing on heart healthy diets and things like that. So this has been kind of part of the wellness or lifestyle culture for a long time. I know most of us know that when you're leaving the doctor's office, you want to be leaving with good cholesterol and blood pressure levels. So all to say, you know, the topic and the importance of heart health has been around for a long time. And we know that these factors here all contribute to the cardiovascular health or the heart vasculature. But what is less commonly known is this intricate heart to brain connection. I love this image here because I think they work so beautifully together. But like I mentioned previously, the heart does this awesome job of pumping oxygenated blood full of vital nutrients to the tissues and organs, including the brain. And you'll notice on the left side of the screen here that I'm distinguishing between cardiovascular and cerebrovascular. When I'm saying cardiovascular, I mean the systemic vasculature in the body, within the body. When I'm talking about cerebrovascular, I'm talking about the vasculature or the blood vessels in the brain. So when most of us think about the brain, we think about this cortex full of gray matter, all the beautiful grooves that we see in these classic pictures of the brain, but we often don't think about how vascular the brain is. And I love this image here. It's a real depiction of the vasculature of the brain. I mean, the reason I love it is because I think oftentimes we forget how vascular it is. And when you look at this, it's pretty evident there's a lot of blood vessels and a lot of vasculature. I think obviously showing the importance of cerebrovascular health. And we know that the health of the blood vessels within the body impact our cerebrovascular health. So what impacts the vasculature of the brain, or what do we know right now about what contributes to vascular burden? There are several well-known vascular risk factors, as you can see there: high blood pressure, high cholesterol, sleep apnea, diabetes, or dysregulated glucose. And we also know of several vascular diseases, both cerebrovascular and cardiovascular. We know cardiac arrhythmias, AFib, having a pacemaker, coronary artery disease, congestive heart failure, having a heart attack. All these cardiovascular diseases contribute to vascular burden on the brain. And we also know, obviously, cerebrovascular diseases that can cause strokes or transient ischemic attacks also cause this vascular burden. So why should we care about our vascular health? I hope at this point I've convinced you that it's really important, but I want to just point out that there are truly very few factors that are as essentially tied to the vitality and the general health as cardiovascular health. And importantly, we know that the systemic cardiovascular health is really closely connected to neurological health. We also know that vascular health impacts our cognitive functioning. So a colleague of mine at the UCSF Memory and Aging Center, Adam Staffaroni, he found that less cerebral blood flow, which is a marker of poor vasculature or good vasculature, depending on the amount of flow, it leads to a slower level of, or slower speed of thinking over time. Another study, let's see, is it changing on your end? I think I might have lost screen access. Let's try again.
We see the vascular health impacts cognitive. Oh, here's a new one. Okay.
Beautiful. There we go. Perfect. Okay. So let me get back on. There we go. So tricky navigating all these things. Okay. So we also know that individuals with heart disease have a greater degree of cognitive decline than those who do not have heart disease. Lastly, I just want to point out that we also have seen several studies, they wouldn't even be able to fit on the screen, that have connected high blood pressure, high cholesterol, other aspects of cardiovascular health to worse cognitive functioning. So this is a pretty distinguished and established relationship that we know exists. And some of you have probably also heard of the term vascular dementia, or a major neurocognitive disorder due to vascular disease. And this is the second most common form of dementia behind Alzheimer's disease. But I just want to point out, oftentimes vascular dementia or vascular contribution is commingling among many other types of dementias. So for those of you who don't know this or might not know this, oftentimes in clinic, when you see a patient who's presenting with any type of neurological concerns, whether that be cognitive or other, oftentimes it's never just one thing going on. And vascular is often commingling and compounding things that are going on in the brain. So that what we can do to reduce this is, it's really important, because it's a factor that's often affecting mostly everyone. I really love this image here from Zuo and colleagues, because it really demonstrates the relationship, or cycle rather, between cardiovascular risk factors and cognitive impairment. What this image is showing is that, I mean, it's really a cycle here, but what it's showing is that poor cardiovascular health relates to an accelerated decline in these respective cognitive domains. And as those domains decline, it actually makes it more difficult for people with these diseases to be able to manage their health, to be able to remember to take their medications and kind of stay functional, which in turn just kind of furthers the cognitive impairment and the cardiovascular declines. So, you know, this image is really pointing to the fact that cardiovascular health as a modifiable risk factor is really important for preventing cognitive health. So now that I've given you this background on cardiovascular health and how important it is for everyone, I'm sure a lot of you are wondering about, what about cardiovascular health in the face of a genetic neurodegenerative condition, such as FTD? And I know that most of this audience today is quite familiar with FTD, but for those of you who are here and might not be as familiar, this is called frontotemporal dementia. And it refers to a clinical syndrome or a set of particular symptoms. And this particular dementia has a genetic link. And it's actually the second most common form of genetic dementia. What we know is there are several autosomal dominant genes associated with frontotemporal dementia. I'm not going to walk through this whole image. It's quite a complicated image, but it really nicely shows this relationship between some of these syndromes at the top there and the genes at the bottom. And what autosomal dominant genetic disease means is that if you have one of these particular genes, you have the highest risk, the highest genetic risk in the population for the disease, versus someone who may develop this sporadically and doesn't have a genetic link. We also know that these genes associated with FTD are highly penetrable, which means if you live long enough, it's more likely that you're going to develop the disease. So it's important, in this case, to consider how can we kind of think about modifiable risk in this population in frontotemporal dementia. And currently there really isn't a lot of work published on modifiable risk in this group. I kind of alluded to this earlier, but working with a genetic neurodegenerative condition provides a really unique opportunity to more directly look at modifiable risk in the face of a high genetic risk, or in other words, kind of looking at lifestyle versus pathology and genes. So I'm going to be talking about the ALLFTD cohort today, and I just want to briefly give an overview of what this is. So this cohort includes family members affected by the genetic forms of FTD. These family members are enrolled as participants in the advancing research and treatment for frontotemporal lobar degeneration, which is the protein changes that we see in the brain, and longitudinal evaluation of familial frontotemporal dementia, the clinical syndrome. And this is a longitudinal FTD study, and it's a multi-site study across the United States and Canada. And the project is co-directed by researchers at the Mayo Clinic and, as you probably guessed, at UCSF. But for the purpose of brevity, I'm just going to be saying the ALLFTD cohort, or just ALLFTD today. So there have been several studies in this group, in this cohort, on physical activity, a modifiable factor known to be related to cardiovascular risk in individuals with FTD. And before I kind of jump into some of this data, I want to point out that our studies are observational, so we can't be certain of the directionality of these relationships. So let's jump into the research, the most fun part. Alrighty. So what we do know about modifiable risk in this population is that physical activity plays an important role. So Dr. Caitlin Castelletto looked at 105 FTD mutation carriers and surveyed their baseline physical activity. So looked at how much they were exercising on day 0, if you will. And then what she did is she measured symptom severity over 1 to 3 years. And what Caitlin found is that functional decline occurred at a slower rate in individuals who were more physically active than those who were not, showing the importance of physical activity. Dr. Castelletto also found that physical activity plays a protective role against cognitive decline, even when there are structural brain changes. I'm going to quick orient you to this graph here. So you'll see on the x-axis that it's showing brain tissue loss. Think about the gray matter and the atrophy of the gray matter. And on the y-axis there is thinking speed, so your ability to kind of process information and think through things. And over time, she demonstrated that those who were more physically active had less declines in thinking speed despite the gray matter volume loss that occurred. So, maintaining a physically active lifestyle, even in the face of high genetic risk for dementia, can help build the brain's resilience to disease above and beyond genetics. Okay. So before I jump into the current project and the data that I've been working with over the last year that's not even published yet, it's hot off the press, as Dr. Castelletto likes to say, I want to briefly also mention another paper that relates to cardiovascular risk in FTD. This paper was recently published by Dr. Castelletto and the ALLFTD team and was published in JAMA Neurology. So what this paper looks at is a filament protein called NFL. And this protein plays a role in axonal structure and in the transport of neurons, so axonal transport and the structure. What we know about this protein right now is that it's a robust indicator of neuroaxonal damage. So when we see this in the plasma or in the CSF, it's an indicator that there's been some damage in the neurons. If you remember what a neuron looks like, it has that axon that's super important for propagating messages between neurons in the brain. And when there's breakdown, there's lack of communication. And as you kind of think through, without communication, our brain isn't going to be able to function properly. So we know that it's an indicator of this damage across neurologic diseases and conditions. There's quite a bit of data that shows that this protein in particular is elevated in both the plasma and the CSF, or the cerebrospinal fluid, which is keeps the brain buoyant inside the skull. In FTD syndromes particularly, including in ALS, BVFTD, which is a behavioral variant of FTD, and all of the other syndromes that I won't get into today for sake of clarity. But we know that the NFL is actually more upregulated in this particular group. So what the data in this study showed is that physical activity, which, as you know, is a very important modifiable risk factor for cardiovascular and cerebrovascular health, is associated with NFL in the ALLFTD cohort. So what we found essentially is that a greater level of exercise at baseline was associated with lower levels of NFL. In other words, the greater amount of exercise, the less neuroaxonal damage. Physical activity was also associated with lower levels and a slower increase, as you can see in this graph here. With times on the x-axis, we have NFL on the y, and then you'll notice that each of those different lines is representative of the level of physical activity. So essentially, over time, we can see that there's a slower increase in this plasma marker that represents breakdown with greater levels of physical activity. Okay. All right, so let's talk about the current study that I've been working on as part of my dissertation. It's also what I plan to present this summer at the Alzheimer's Association conference, excuse me. And what I decided to look at was a whole bunch of modifiable risk factors. This is a metric called Life Simple 7, and it's a variable that is considered to be a nice representation of cardiovascular health, and it's actually been associated with dementia risk in other papers. Life Simple 7 includes the American Heart Association's 7 most important predictors of heart health, including blood pressure, cholesterol, glucose, or blood sugar rather, smoking, weight as measured through BMI, diet, and exercise. And I just want to point out that these are not in any particular order. So for today's talk, I'm going to be referring to Life Simple 7 as LS7. And it's not been examined in individuals with genetic FTD. And it's a particularly appropriate metric for this population because individuals with genetic FTD often have a younger age of onset than other forms of dementia. And the fact that LS7 includes both behaviors and biometric measures that might be better for early detection makes it a little bit more appropriate for this population. Whereas some of the other metrics of cardiovascular health that exist in the research right now are more representative of later on vascular changes that occur in aging. Okay, so I wanted to show you the aims of this study and what we were hoping to see at baseline. So at the first time we were looking at these individuals in this data, we were hoping to see that with greater LS7, and on the left you can see the arrow there, we would expect higher levels of cognitive and brain functioning. It's important to note that higher LS7 scores is better. So the higher your score, the better your cardiovascular health. Another aim that we had was to look at this relationship over time, but also to be able to compare between non-carriers and carriers. So as a part of the ALLFTD cohort, there's also family members that are included in this data set that do not have the gene, so that we can kind of compare to a group most similar to the genetic mutation carriers. So what we were hoping to see and what we looked at were some particular outcomes of interest that we know are important for FTD. One of which is executive functioning, which involves tasks like decision-making and problem-solving, organizing, multitasking. And executive functioning is a pretty, oftentimes people think of it as like a frontal lobe process, but it really activates our attention, and it's a really important skill to have to be able to be functional. We also know that this particular domain is impacted in FTD. When you think of FTD, frontal temporal lobar degeneration, that atrophies and affects this cognitive domain. We also had language as another outcome of interest, and memory, along with gray matter frontotemporal volume. This is the region that I was just mentioning that typically atrophies in FTD. We were also interested to see if this differed between carriers and non-carriers. And I already mentioned kind of why we were able, or why we wanted to do that, to be able to compare these relationships and look at kind of the influence again of genetic and lifestyle. Importantly, what we saw at baseline here is that there was actually no difference between LS7 or cardiovascular health between the carriers and non-carriers. So if you look at the graph here, you can see the carriers on the right side, the blue dots, and then the green dots are the non-carriers. And there wasn't a difference between the two of them. So they had the same level of cardiovascular health at baseline. I really wanted to point this out, particularly because one of the challenges that have been mentioned in other research papers that have looked at some modifiable risk in FTD is that some of the clinical symptoms associated with FTD are kind of impacting the vascular health. So for those of you who may not know, one of the symptoms is hyperorality, or eating more sugar, eating more in general. And obviously we know that diet is very closely linked with vascular health. So we didn't want that to be a confounding variable in this relationship, or in these relationships that we're looking at. So it was really important and notable that there was no differences between the groups at baseline. All right. Before I tell you what these graphs mean, I just want to orient you again to these graphs. You'll see on the x-axis, we have life simple 7, which you can think of as one's cardiovascular health, and higher is better. So the higher the score ranges from 0 to 14, the better life simple 7. On the y-axis in the left graph, you'll notice executive functioning, which I mentioned earlier, but this is a z-score here. So the more positive, the better. Executive functioning, as a refresher, is what helps us make decisions and organize. What we found at baseline is that better simple 7, or better cardiovascular health, related to better executive functioning. So better decision making, problem solving, organizing, which is a super important functional outcome for individuals with autosomal dominant FTD. On the right side graph, you can see the y-axis here has frontal temporal lobe volume, which I mentioned earlier is something that we know atrophies within this disease course. And at baseline, again, we saw that greater cardiovascular health, better cardiovascular health, related to less atrophy of this region, so less volume loss. So again, super important to think about this impact of cardiovascular health. And again, these were relationships that we saw at baseline. So interestingly, when we looked at these same outcomes that I mentioned earlier in longitudinal models, we saw a flip, a change to the other domains that were not impacted at baseline. So before I explain again what these findings mean, the x-axis on these graphs is time, so over time, whereas the y-axis is the same z-score for memory and language, where higher or less negative is better. And these graphs are comparing these relationships between non-carriers, so healthy family members, and carriers, genetic mutation carriers. But what we found is that over time, better vascular health related to memory and language, so better memory and language, or preserved memory and language, if you will, because this is over time, instead of frontal temporal lobe volume and executive functioning. So we found this pretty interesting because at baseline, it appears that cardiovascular health kind of provides some type of protective or resiliency against these particular domains that are affected in this genetic disease. But over time, it switches to protecting some of the other domains that are impacted later in the course, and less on those initial disease or areas of impact in terms of the frontal temporal lobe and the frontal executive functioning. What we also found is that these relationships actually differed between carriers and non-carriers to a significant degree. So it was more important for the carriers to be focusing on their cardiovascular health, and there was more of an impact on cardiovascular health in terms of their memory functioning or the rate of memory decline.
Is that years at the bottom?
Yes, yeah.
Wow, that's really cool. These people
Yeah.
were 7 years?
Yeah, yep. So we really pushed to get data, longitudinal data, and then we did have up to, I think 7 years was the max amount that we had, so 7 visits, because they come yearly. Individuals come for their visits yearly. So, yeah. Alrighty. So conclusions for this particular study: cardiovascular health may be a really important, I think it is, potentially modifiable risk factor to mitigate both the cognitive and behavioral disturbances that are associated with pathogenic variants of FTD. It's important to continue focusing on reducing cardiovascular risk throughout the life course through exercise and diet and reducing stress. And it felt wrong for me to kind of end this talk without giving you some actionable items, things to take home with you. And I want to just point out that these are not data-driven. I can't say that these are based on data. These are just things that I do in particular to optimize my cardiovascular health. The first is trying different types of exercise. We know that high intensity interval training, or HIIT, can be particularly helpful for blood flow. And you can actually engage in interval training wherever you are by simply incorporating something that I tell patients and call, and kind of made up this thing called a chorus walk or a chorus HIIT exercise. And what I mean by that is whatever cardio that you're engaging in, when you're listening to music, every time the chorus comes on, you intentionally increase the intensity of your workout. And this is in a safe way to engage in HIIT exercise wherever you are and however old or young you are, because everyone's level of engagement is basic or is particular to them. So it's a safe way to be able to get your heart working a little bit harder in a safe interval way, or in intervals that are more safe for older adults or even middle life. Another thing that I often do, and I think is really important for cardiovascular health, is focusing on high protein and a low sugar diet. Having high protein in the morning, there are some studies that show that it actually leads to less of a glucose spike throughout the day. And for me, it makes it easier to make healthier decisions throughout the day. I personally love hard-boiled eggs, and I find that it's an easy way to incorporate protein. So I'd encourage everyone to do so. And if you're annoyed by the way it takes a while to make hard-boiled eggs, I recommend getting this little egg machine here. It makes it really easy to have protein with you wherever you are. I also know that when I have sugar, it makes me want to have more sugar. So I try to incorporate protein to be able to kind of combat sugar in my diet. I also find it really important to incorporate greens in every meal. And I want to just say that it doesn't have to be complicated. We know that greens, any type of greens, are really full of vitamins. And in particular, there's these little microgreens that you can find at Trader Joe's that are high in polyphenols, which are particularly beneficial for brain health. And there are several studies that show this. All right. Another thing I just want to point out is that water is your best friend, and it's important to avoid drinking drinks that have hidden sugars in them. If you want something tasty, I recommend starting with kombucha or sparkling water and trying to avoid sugary drinks, as they are pretty sneaky in terms of the level of sugar that they have. Another thing that's important for cardiovascular health is reducing your stress through meditation. I will say this is the area I'm not the best at, but I try to be better at as a PhD student. But I recently started using an app called Headspace that makes it really easy to just spend 5 minutes taking a deep breath and reducing our stress, which reduces our baseline heart rate, our resting heart rate, which is a very important indicator of cardiovascular health. And lastly, I saved the best for last. This is the one that I find the most important. It's the idea of moving throughout the day. So we all know that physical activity is important, but I think oftentimes that we forget that if you do a 45-minute exercise in the morning and then you're sedentary the rest of the day, that's really important to think about. We know that sedentary behavior is really impactful in healthy brain aging. And if you're sitting all day after a workout, you're not doing yourself any, well, I guess I should say it's better to move more throughout the day than to just do that exercise in the morning. So I say, regardless of where you work, it's really important to take breaks for movement. I think if you work in an office, it's really important to think about requesting a standing desk or taking moments for a quick stroll. I also think it's important to wear sneakers, because that means you can always be on the move and that you can get a walk in no matter where you are. If all else fails, my last recommendation is that you get a dog, because not only will they force you to move more than you ever have, but they also provide a huge endorphin boost, and there has to be some kind of data on that and how it reduces stress. All right, I just want to quick say thank you to the ALLFTD collaborators, the participants, and the family members within the study, along with all of the funding that we receive for the study. All right.
Well, thank you so much, Anna. I really appreciate this wonderful talk, and thanks to you and your collaborators, and of course to all the participants as you so did well as well. Thanking them. We have a question in the chat already. I did want to just, I don't know if this is a question, but this is probably top of mind for many people on the call because many of us are impacted by C9orf72, which of course, is the most common genetic cause of ALS. So there's a lot of research from ALS focused people and the FTD focused people. And I really don't expect you to have an answer or anything, but more just opening up this for conversation on some level. The researchers on the FTD, on the ALS side, have come down with some counterintuitive findings to some of these, which I find very persuasive, everything that you've presented. But Jonathan Cooper-Knock came out with a paper a couple of years ago that said exercise was a risk factor for ALS, and presented data from C9 people saying that it led to earlier onset. So that's out there. And then also ALS Families Project, which is a inherited ALS, including C9 study at Columbia, published some posters. So they're not papers, but I've seen the abstracts from Dr. Matt Harms, that the weight, the BMI of the C9 carrier, of the genetic carriers, but their cohort is like majority C9, were significantly lower than their relatives in the study, their non-carrier relatives, which, ALS is known to have hypermetabolism. And so, I think they're thinking that it was that's going on in the carriers as well. And even to that point, even informal advice from genetic ALS experts is to have a overweight body weight, maybe not obese, but to don't be skinny, basically, because skinny people have worse disease progression in ALS. And I'm not, anyway, there's just like these competing things in the literature, and just raising that, and wonder if you have any comment or if this comes up at all in your lab or anything like that.
Yeah, I do have some comments on that. The first is that I think one of the challenges, like I mentioned at the beginning about looking at cardiovascular risk in this particular population, is that inability to tease apart some of those behavioral symptoms and the impact and kind of intersections between those and vascular health. And I haven't seen a whole lot of studies where I trust the data that's been out there in the design of the study. I will say that I did look at genetic or gene carrier differences between C9, MAPT, progranulin, and there were some differences kind of showing up, but I don't trust our data yet either, because we didn't have enough between the three different groups to make powerful statistical conclusions. So I'll just say that kind of upfront. The other thing I'll say is that, I'm biased, obviously, but cardiovascular health is just so incredibly important for the entire structure of the brain. We know that the vasculature impacts atrophy. We know the vasculature impacts your stroke risk. Your risk of hypertension, high blood pressure, all of these other factors that create this vascular burden on the brain that contribute to more decline in all of these other areas. And so for me, I would say, whatever that data might be, great. I definitely don't think that anyone should be at a BMI that's considered obese. I will say that, maybe it's important for people with ALS to just focus on not being underweight or like very significantly in shape. And I think that you can still really optimize your vascular health and kind of do both things. And how I would do that is, focusing on movement, but not super high intensity movement. And focusing on nourishing foods and just eating more of those nourishing foods rather than eating foods that might contribute to weight gain, if that makes sense. That's how I would personally approach it. But I think what's so exciting about this project and about this field and the ALLFTD cohort in general is that there's so much left to be done. Like, this is just the first study that I plan on doing. And I have like 7 different studies to branch off of this one that I think can really start to tease apart some of these questions that we have. But I would always bias towards still focusing on good cardiovascular health.
Wonderful. Thank you so much. Yeah, no, we just all wish that the ALS and FTD sides that are studying us, in many cases, the same individuals are in both studies, and so like, it would just be great. But everything you said sounds perfectly reasonable and makes sense. So there's a few questions in the chat that I will read out to you. Is there anything you could say about the risk to cardiovascular health from COVID? And maybe avoiding COVID would be a very good thing, or other things like that. So thoughts on that?
Yeah, I'm not as familiar with the data on COVID infection. I know there's been several studies on it. I think, I think it's really hard to take cardiovascular health and pull it out of any other health-related factor. It's the entire body, it's systemic. It affects everything. I don't know particularly any specific risks or relationships between the two of them, but I can only guess, that COVID probably has some impact in cardiovascular health. I can also see this other question about my thought on high impact exercise and its effect on brain health. There is several studies that talk about the benefits of high intensity interval training, and the way that it benefits through the increased heart rate, getting the blood flowing in a way that doesn't occur when we do LISS exercise or low intensity slow intervals, slow like a long run or something like that. I like to tell people to incorporate it safely however you can. I think it's hard to tell, in this group here that I can see, you are middle-aged adults, not older adults. So I would say, it's not a safety concern, but oftentimes that is the concern when we're making brain health recommendations, which is why I talk about, chorus walks, and it's a safe way to be able to do that however you exercise. In terms of the length of time it takes to be optimal, I'm sure I've heard some data on that from in podcasts, like Dr. Huberman and things like that. But I would just say, for me, what is more important than getting in, a specific amount of time is thinking about movement throughout the day, and finding ways to get intervals of movement throughout your entire day. And my reason for that is, again, sedentary behavior we know is a huge risk factor for worse brain aging. So it's important to kind of avoid sedentary behavior. Personally, I like to try to exercise 45 minutes or more. I think that kind of engages the cardiovascular system a little bit more when you're having to push yourself for a longer amount of time, but I don't know the specific data on that.
I guess I have a question on more like diet related, or is there anything that you guys have seen that's like truly like neurotoxic things within food? I know you mentioned sugar, and we kind of all know, especially I'm an FTD family, and so sugar does become something that's very compulsory and very highly addictive. And obviously with brain health, it fuels brain degeneration. So is there anything else like neurotoxic things that we should be avoiding for those that are like myself at risk?
Yeah. I'm not going to name any particular like compounds because I'm not familiar with any specific, other than, I know that there's plenty of data on sugar and the impact of processed sugar. But what I'll say is that I think processed food in general, and again, I'm not saying this from the point of data. I'm thinking about this. There is a lot of data on this, not maybe specifically to brain health, but to the cardiovascular system, which in turn, impacts brain health. About just the downsides of processed food and the ingredients within a lot of processed food that we don't actually know about, and that might not even be regulated. A lot of supplements have stuff that actually isn't regulated as well, because you don't have to get approval until there's a problem, which is terrifying. It's really important to think about where you get your supplements from. But I would just say, something that I focus on always is knowing everything on the ingredient labels if I can. I want to know what those ingredients are, and focusing on eating real food that we know comes from the earth and isn't modified in any way. I think those things can only provide benefit. So, yeah.
Any other questions? Yeah, sorry.
No, it's okay.
Just to jump in with one, it sounds like you got a lot of projects related to this that you're thinking about. I'm sure this might be in the hopper already, but if it's not, just a plug for it, I suppose. Looking at the role of, or at least, what can be gathered about people's exercise or other cardiovascular, data related to age of onset in people with these genes and with these diagnoses.
Yeah.
That would be really cool to see that.
Yeah, that's a fantastic idea. So I just want to make sure I understand your question, because I'm going to go write it down after this. Like I said, there's so many things that I want to do with this in this group, because all the syndromes and all the genes, there's so much to tease apart. But what I'm hearing is that you're interested in how cardiovascular health might impact the age of symptom onset, or the age of seeing symptomatology and switching from asymptomatic to symptomatic in FTD.
Yeah, and I know that the phenoconverters are few and far between, because it is a lifelong risk and happens all up and down the lifespan. And even if somebody goes for 5 years, the odds that they'll become fully symptomatic in that 5 years is like not super great. So I know that there's not a ton of converters. So even absent somebody being longitudinally tracked into the disease, even just trying to capture what their activity levels were or something, or if that exists already and could just be looked at or something.
I can tell you that first of all, I love that question. I'm going to keep that in mind. And another thing that I wanted to look at, but I had to narrow my focus because I was too excited about all of this. And it was like, you can't answer every question in one paper, especially when you're trying to get it published for your dissertation. Is symptomatic versus asymptomatic, and looking at also sporadic versus genetic. And I have those questions. I briefly looked at some of it. And there is so much to look at within this group, like I've mentioned. But we are keeping these things in mind. And I think that that particular question would be fantastic and definitely achievable to look at with this variable. This variable also wasn't in the data set before, so I created it, I coded it into the data set. So now other people I know are going to be using the variable in some imaging studies. I'm working with some people at UBC that want to use it, and I created 2 different vascular scores into the data set. One's vascular burden score that has been used in other studies, but this one in particular, I think, is a lot better for FTD, like I said, because it captures some of those younger behaviors that maybe you wouldn't see, that wouldn't be captured by the vascular burden score, which is more disease representative versus behavior. And that's what I found when I looked at it in the data set.
Well, that's wonderful. I just dropped in the chat a link to our spreadsheet that has studies recruiting genetic carriers. So, consider if you want to talk to those people doing these other studies like DIALS or PreFALS or Columbia ALS Families Project, some of these other ones, because I don't know if they're tracking this either, and might be good to see if they're interested. I know sometimes people always don't play super well together, but we'll see. There is something, and I don't know how open it's going to be, but the physician that we work with a lot, whose organization that we operate under, the ALS Hope Foundation, she's the president of, Dr. Terry Hyman Patterson of Temple University, is hosting a workshop in September with many genetic ALS and FTD experts from around the world, but I think they're only shooting for 40 people, so it's not quite a conference. But they're considering what what people should be told, like what people in our position should be told from a medical perspective. And certainly, this all stuff seems very much on that tip. So
Yeah.
I don't know if anyone at UCSF is plugged in. I think Dr. Bove is plugged into it.
Yeah, probably.
So just putting that out there.
Yeah, I'll definitely follow up with Dr. Castelletto about that as well.
I was gonna
And
say too, just having like that, just the basic data is more information that most of us get when we get our positive result status. So the fact of even having any iota of information on things that we can be doing now, you know, we are kind of that population that we don't have anything else to lose because we've kind of lost so much of that control already, that you're giving us the ability to take control of aspects of our lives that we can modify. And I think that's massively important, because if a doctor says don't ever eat this food because it will prevent you from getting, FTD in the future, you can bet hands down all of us would get rid of it in a heartbeat, no questions asked. And so having even that basic data set on easy things for us to do, I think it serves a purpose. I mean, I think too, what would be interesting is like finding a form of like a technology platform where you can almost like have some of that stuff check in. I know that that's like way beyond, but like gentle reminders, like move your body, it's kind of like taking all those different apps for meditation, working out, breathing, diet tracking.
Sure.
Create it and collaborate it so that you're tracking all those things at once to making, it's a way to hold yourself accountable in a sense.
Sure. Yeah. And, that's a huge thing to kind of combat some of those functional declines over time. If that's an app that you're using and creating a relationship to early on, the odds that you'll continue to use that even when some of that functional decline occurs potentially and you need it, could be hugely protective. But I just want to say thank you so much for saying that. It means a lot to hear that, because well, first of all, I think it's so awesome to be able to work with a group that's so motivated. I've talked to older adults, like I said, since 2015, working in a neurology clinic, and you are all super motivated and want to do things to change your trajectories if you can. And I'm so glad that even, a sliver of hope was given today that you do have some control, and that this could make some impact based on these data. It's pretty promising. I plan to continue looking at more and to continue pushing this modifiable risk question in this group. And yeah, I'm super excited to continue disseminating on Twitter or wherever else.
Well, thank you so much. We so appreciate you, and clearly your drive and passion for this is very touching, and we really appreciate it. Greg, did you have anything you wanted to jump in with?
No, sorry. I was just going to thank Anna. It's wonderful. It's often a very hopeless situation. So anything we can do from a lifestyle standpoint to delay onset and just give ourselves a better chance for therapeutic intervention to come around, it's great. So thank you for the information and all your work you're doing.
Of course. Yeah. You're very welcome. I also want to quick say before the recording ends is that my thank you slide got messed up. So my slides actually got messed up last night and I fixed them last minute. Didn't catch the thank you slide though. So it didn't have the ALLFTD cohort and the ALLFTD team that are old Hillbloom one. So just want to say thank you to the ALLFTD cohort and all the collaborators that help on this project, and make a quick note of that.
Very good. Just so everyone knows, our next event scheduled, we don't have a page for it yet, but it's going to be on Tuesday, June 27th at 9 a.m. Pacific. Julie Pierrat, who is in Rosa Rademacher's lab in Europe, is going to talk about genetic modifiers and their impact on C9orf72 and progranulin and all these diseases in general. So stay tuned for that one. And so glad to see you all. And thank you again, Anna. Brooke, did you have a question? We got a minute. Sure, if you want to jump in.
I was just trying to say thanks, not raise my hand. Sorry. Presentation.
You're so welcome. Thank you for coming.
All right, all. Well, enjoy the rest of your day, and let's all work together to get these diseases off the table.